Hello everyone. Today I'm going to share my views about occupational therapy in speech or language communication delay in kids with autism, developmental delay, learning disability and ADHD. There is a common myth, specifically among parents, where their kids are facing difficulties with speech or language communication delays, that occupational therapy is not required by them. But that's not so. These parents seek help from speech and language pathologists, which is actually important and required by them. But the same child, when gets occupational therapy along with speech therapies, shows much more improvement in speech related skills, feeding related skills or language related skills. And the reason behind that is sensory issues. The same child is either having overloaded sensory system or underloaded sensory system. I have already spoken about this in my previous video. So if you have not seen that, kindly click the link below in the description box. So when occupational therapy activities are given to these kids able to optimize their overloaded sensory system or underloaded sensory system. Because of this, they are more able to self-regulate and participate in social, verbal or non-verbal communication skills.
Hi, I am Vanilla. My son was diagnosed with mild autism 3 years back. At that time, he was just 2 years old. I was not fully unaware about occupational therapy at that time. He used to show different repetitive behaviors and sensory features, and I am not aware why he is showing those behaviors. So, as referred to by my child psychiatrist, I met occupational therapist Dr. Priyanka. She actually in detail explained me about the Virat's sensory processing challenges and how occupational therapy can optimize sensory needs of a child using sensory integration therapy in her occupational therapy sessions. So at that time, Viraj don't have eye contact. He doesn't respond to his name. He used to just rotate objects whole day continuously. He used to stare at lights. He used to not follow instructions. He cannot express his needs. So at that time, I was more concentrated on speech therapy as Viraj was non-verbal. But later on, I realized occupational therapy along with speech therapy will work wonders for a child to improve in all areas. So I started taking regular occupational therapy from Priyanka. She used to give therapy using different swings, suspended equipment, brain gym activities, and different textures, different fine motor, gross motor, and as massages and deep pressure techniques. So with regular occupational therapy, slowly I started seeing improvements in my child, and he developed very good and stable eye contact now, and consistent eye contact, and he responds to his name 100%. He stopped staring at lights, he stopped rotating objects, he stopped flapping his hands. He started following instructions, and receptive learning increased very much, and he also started expressing his needs, some of his needs. So at the end, I just wish to state, like, taking just speech therapy for a non-verbal autism child is just a myth. Occupational therapy along with speech therapy will only get good improvement in child. Unless the sensory issues are not resolved, we cannot see improvement in the child. As a prerequisite to speech, we need good sitting tolerance, and we need child to pay attention to what we are saying. He need to listen and understand what we are saying. Only then speech comes, and all these can be improved only with occupational therapy. What I feel is, for my child, occupational therapy along with speech therapy help him to improve very much, and he was able to express, like he is able to understand and express his needs verbally. He started expressing his needs verbally now. Thank you.